As our NHS battles through yet another horrific winter crisis, our Health Secretary has been on the news today announcing plans for a new NHS Online virtual hospital. It will cover 9 common conditions with the idea of reducing waiting lists through using the NHS app and video appointments. Now, on paper, this might sound like a positive thing, but if you listen closely, there is a big gap between the promise and the reality.
Well, we're putting £100 million into setting up NHS Online.
So 100 million might sound like a lot of money, but in NHS terms, it is a tiny drop in the ocean. The reality is that the NHS has been underfunded to the tune of tens of billions of pounds every single year for a decade and a half. This has left us with staffing shortages, buildings falling apart, and services being stretched to absolute breaking point. And so far, this government has refused to invest at the scale that is actually needed to meaningfully tackle that crisis. Tinkering around the edges with £100 million is simply not going to cut it. But crucially, who is actually going to deliver these extra appointments? Because waiting lists don't exist because doctors and health workers just have spare time that they're not using. Here's how Streeting responded when he was asked how this will be staffed.
So where you've got specialists who are able to do some extra sessions through NHS Online.
And then when he's pushed on where this capacity will come from...
There are always doctors who are opting to do additional sessions either in the independent sector.
And there it is, the independent sector. Time and again we see this phrase being used by politicians. And you know what it actually means? The private sector. And let's be totally clear what this means. The private sector is literally poaching NHS-trained staff away from the NHS. It's not the case that a bunch of spare capacity is going into the private sector and it's also staying in the NHS. No. The increase in private provision is directly harming the capacity of the NHS and therefore directly harming patients. In refusing to fund the NHS properly and overly relying on digital and tech solutions whilst also increasing the role of the private sector, this government is setting the NHS up for failure. What we actually need is real investment in the NHS to rebuild the capacity that has been lost over so many years. So what do you think about the plans for a virtual NHS hospital? Let us know in the comments.